Hi, my name is Tristan Smolarczyk, and this is for the Ortho Lab Evaluation Reflection 3. For my third evaluation of the semester that I'm doing this over, I had evaluated a patient from the swim team. They had come in complaining of right shoulder pain, and because they had slammed their outstretched arm into the wall of the pool, causing their shoulder to dislocate, or sublux because it went back into place, and had come in after practice, continued practice just like that, and had come in after practice complaining of the pain. I had done my evaluation, and my preceptor, Alex Van Dusen at South Vermain High School, he and I discussed what all I had done well, as well as all that I needed to work on. He said, honestly, it was probably one of my better evaluations I had done, because I was very new with all the shoulder information, so I was learning. I had some of it down by that point. And so he said I had done really well. He said it was an overall good evaluation. It was just like all my other ones, very slow. So he said I needed to pick up my pace on my evaluations because I can't take like 20 minutes doing an evaluation. And he said that next time, if I'm going to do an evaluation for something like this, I definitely should use a goniometer to help measure the range of motion, because especially since he had limitations, it was definitely something that I should have used a goniometer on. He said if there's not really limitations, then there's no need. I mean, as long as it looks within normal limits, but it was definitely limited in a couple ranges, such as, let me pull it up. He was limited in flexion as well as abduction, but those were the two ranges of motions I definitely should have used a goniometer on. I had started off going through my history, as like I do with every evaluation, because I feel like you get a lot out of it. I started off with my history, gone through. I was mostly making sure that there was no labral tear, so asking for popping and clicking was definitely important. Asking about if the pain was more diffuse, if it was sharp, if it was more in the back, the front. I could definitely tell you where the pain is and what type of injury could occur in that area. After my history, I made sure that I had all that I needed. Made sure I was able to rule some things in and out, what I could possibly test for, what I was looking for, range of motion, man muscle testing wise. For my range of motion, I was mostly seeing, I went straight from history to range of motion because I found that was important. I wanted to know what motions were causing the most pain, because if they're having pain, internal rotation, external rotation, you might be a rotator cuff, same with flexion, abduction, as well as extension. If they're having issues with the first 10 to 30 degrees of abduction, it could be supraspinatus. So I was making sure, going through all of that with them, and just making sure the patient was overall mobile in what motions hurt the most, as well as what motions seemed almost impossible. And like the patient said, they had some instability, so I learned what motions felt the most unstable, they felt like it was going to sublux again. And then I continued to do some palpations because I needed to know the exact point of pain, as well as what structures in the area might be affected. And then I continued on with my medial muscle testing, because once I got my palpations down, and say if the supraspinatus was where it was 10 to 2 palpation, then I could continue to manual muscle test that. I mean, it's more of a palpate and then decide what structures in the area could be most affected. Manual muscle test that, rule in, rule out. I was mostly testing to see if there was any kind of weakness within the muscles, because the patient said that they felt some instability. Therefore, I needed to make sure that maybe if there was muscle involved, such as if the muscles were impinged, it might feel unstable, as well as if the muscles were stretched due to the subluxation, they might be weak, might need some more strengthening to help kind of control, because they help control the joint a little bit more. And then I continue on with my special tests afterwards. My special tests were overall just absolute make sure, rule whatever I can out and in. I had a feeling that the patient had some major instability. I wanted to check for a labral tear because oftentimes when you dislocate your shoulder, you can have a labral tear. That's usually what happens with most. I also was testing for any kind of I did test for a little bit of impingement. I didn't really see a whole lot with that. I had tested a lot of the muscles, such as I did the Hornblower's test, internal external rotation leg, signs empty can. I was testing to see what muscles might be involved as well. Overall, I found that the instability tests, such as anterior or posterior or sulcus, those were all positive. Some of the rotator cuff muscle tests, special tests, were positive as well. All the labral tests I had done were negative. I could have done more, so that's definitely something I need to work on. I felt that overall, though, the evaluation went really well, went smooth. My preceptor was quite pleased with it. I don't really think that, if I could go back, there's definitely a lot more I could have done, but such as more labral tests, just to make sure done more of a cluster instead of just two. I definitely could have used a goniometer to test how limited the range of motion was, but overall I felt like it did go really well. I knew my stuff. I overall made good decisions. I guess my action plan would have to be to my action plan for the future would definitely have to be improving my skills with the goniometer. I've said this in the past several videos. It's definitely my weak spot. I just go to visual all the time when I definitely know numbers are better to have, especially when I work in a PT clinic or something like that. Having numbers is definitely better. So my goal is to use a goniometer as well as to practice that along with my evaluations, because I do know I need to pick up the pace. Taking 20 minutes on an evaluation is not going to work, especially if I'm going to work in a quick pace setting. I mean, if I'm going to work in a PT clinic, I might be able to take my time, but for high school settings and even college settings, you don't have that kind of time. You need to kind of be in and out with the patient and make sure they're getting what they need within that time. So my overall goal action plan is to practice evaluations every day at my preseason clinical site and diminish my time to at least maybe 10 minutes or under would be definitely a lot better than 20. And then I will at least attempt to use a goniometer during the same time of my preseason clinical site at least 3 times a week. I would like to at least practice that. I would go over it with my preceptor, make sure I know the ranges 3 times a week, try to use it all day long if I can, and just make sure I know the ranges, I know how the best ways to perform range of motion, which way the stable arm goes and the moving arm goes, because I struggle with that so much. I take too much time using goniometer. So I would like to practice that 3 times a week. I would like to practice my evaluations every single day, because the more I do them, the better I'll get. And so all day long if I can for both of those. And I'm just hoping to learn how to be a better clinician, because I have discovered that I think I want to work more in a rehab setting and more in a PT clinic rather than just a high school setting or anything like that. So I definitely need to work on those if I'm going to work in that kind of setting. And I mean, my action plan mostly involves just a lot of practice. I mean, my SMART goal overall is measurable, because goal is to get those down within the 3 weeks of my preseason clinic psych before I begin my junior year clinicals, because I would like to definitely impress my next rotation after the first semester and just become a better clinician overall. So practice is what makes perfect, and I'm hoping that maybe one day I can come back to Alex and impress him with how speedy I can be.